2, educate the patient on autonomic dysreflexia, and 3, perform strengthening exercises to upper extremities.
Wait. Repeat. Do the description again.
Patient's 45-year-old, status post-complete lesion at C7, C8, uninvolved movements are good.
Okay.
So, you want to do the first one? Oh, right, okay.
Ryan, did you do it?
Okay, so, you can actually unbuckle your seatbelt for this one. We're basically gonna do what Alex was doing earlier, and we're gonna have him perform some dips. So Ryan, if you can, yeah, exactly, place your hands on the wheelchair handles, okay? Make sure the brakes are locked, which they are. And you're basically just going to push down as hard as you can, so you lift your butt off the chair. And then when you do that, try to hold it for about 3 seconds, and then just slowly lower yourself back down. Give it a shot. 1, 2, 3, come back
Okay,
down.
what was it, C7, C8?
Yeah.
C6, C7, C8?
Yeah. Well, his abdominals are out, but, well, I guess I should keep the seatbelt on, actually.
Yeah, I
Yeah.
would probably, and I would probably put his feet on the floor,
Oh,
because he can tip over.
yeah, it's true.
He can tip himself and he's not gonna know it, that he's tipping, and he doesn't have the trunk to recover from the tipping. And I'm just thinking, I don't know, and he doesn't have lats, so don't do such a good dip.
That's, okay. And then for performing strengthening exercises, we were actually just having using the TheraBand as well.
Okay,
So we did triceps. So Ryan, basically what you're gonna do is you're gonna hold both ends of the TheraBand. You're gonna loop it around like this. You're gonna hold one side close to your chest. And it's gonna push down like this. Okay, so that's for your tricep exercise. You can try that.
let me check.
That was like someone's
Just for legs.
killing people outside.
What?
I've been hearing a lot about
Awesome.
shootings that I'm getting scared.
I don't know what that was.
Okay, just a cockroach.
Wow.
So that's the tricep exercise.
That was not recorded.
I thought a mouse.
Got that.
If you want to make it a little bit harder, what you can do is you can put it around. I'll take this one. Yeah. I'll take this guy. You can go against gravity. Put it like this. Go like this.
Even better, yeah.
Or if you want to do the biceps, you can hold on to one end like this. Just bring it up like this, just for general strengthening.
Yeah, because resistance against gravity for someone who's normal, basically,
Mhm.
is probably the best.
And then for your deltoids and your serratus, you can go this for abduction, going against gravity.
How many times would you have them do it?
3 sets of 10, or as tolerated.
Yeah, or maybe even 8, just to make sure you don't overdo it, because, they're, kind of manipulating their wheelchair all day, so they're getting plenty of exercise.
Okay. And
You
then
don't wanna do overuse.
and then we did a serratus one because if he's gonna be, wheeling his wheelchair, he's gonna be doing a little bit of protraction, so
Does he have serratus?
at C8, doesn't it? Oh, I guess not. So then no, forget that one. And then, let's see, and then we just said for objective, educated the patient on the symptoms of intervention of autonomic dysreflexia.
Go ahead.
So if you have complaints of increased heart rate or dizziness, sweating, nausea, blurred vision, anything like that, you can always, check the catheter to make sure that it's not blocked or anything. You can loosen any tight clothing that, maybe like restricting you a little bit. Try to avoid any extreme changes in temperature. And, if that doesn't work, then we can call somebody and they call 911.
Yeah, make sure you sit up first, right?
Yeah, and set up, yes.
If they're laying down, sit up first. And always give an introduction. There is something called autonomic dysreflexia. You may experience this because you have some risk factors. So let me tell you what to do if this ever happens. Right? Always give kind of an introduction, and then talk about the symptoms, and then talk about what you do. And if you still don't feel well, make sure you call someone immediately. Okay?
those were his strengthening exercises. And then, I think that was the only 3 things that we.
Was that it?
Yeah, oh, yeah, and then just the documentation, yeah. And then, oh, sorry, there was another thing that we wanted to do, but he'd have to be on the mat, so.
Okay.
Do you want me to transfer him first,
Sure.
or, okay. Ryan, which one's your dominant hand? Your right hand? Okay, so I'm turning around. Okay, and then I will hold your legs, and then can you just wheel yourself so that your face.
That's what I mean, you can't ever forget anything that we taught you. Did you see it again?
Oh, sorry.
Cross your fingers.
I got you. All right, and then just relax. Now just lock your wheelchair. Okay, now I'll take this off. Anything out of the way. Then you can unbuckle your seatbelt.
Okay, I'm gonna transfer my patient.
So I'm gonna transfer my patient using the sliding door transfer with contact guard.
Contact guard to minimal assist depends on how much of a boost they need, but,
Okay.
you know, they don't have trunk again, so. I mean, they may have a trunk support, but they don't have trunk initiative, so.
Okay, so can you use your arms to pick up your leg and cross it over? Oh, try that. Okay. So I'm just gonna. Scoot this under you.
I'd rather have the Christmas one.
Oh, okay. Okay, and then what you're gonna do, you're gonna cross your legs,
Yeah, I told you, one of the students' husbands made all these.
Oh,
ones. Yeah.
making sure the
Yeah, it was really nice.
wheelchair is locked.
Somebody made my power board for me.
Okay, yeah, so exactly, you're gonna place your hand here, try to avoid putting your hand into the hole, and then what you're gonna do is you're gonna push off of here, and then you're just gonna scoot yourself over. I'm gonna make sure that, you know, you don't fall, so I'm gonna contact guard you, and then on the count of 3, we can, start, so go ahead. Push off, and go. Good. Good.
That t-shirt right there.
All right, I got him. So yeah,
He's good.
he's good. So basically, the exercise that we were gonna do, we can take this off now, cross this leg over. Okay, that works. We were gonna do like an alternating isometric. So Ryan, can you place both your arms down by your side so you're supporting yourself? So you're fine, okay? I'll contact guard you, so basically just using your arm muscles, I'm gonna try to kind of push you over to one side and just don't let me move you, okay? So if I push you here, okay, just like this, that's good, okay? From here, okay, that's good. Now can you place one arm right in front? And keep that one a little bit more back. Okay, don't let me push you back. Okay, don't let me pull you forward. Maybe about, 5 to 10 seconds for each set. Make just so he's weight shifting in all 4 directions can help him with his.
And it's all arms, right? It's nothing trunk.
Yeah, there's
not
nothing you can
developing
do
trunk,
there.
But at least you're working on the arms. Okay,
And I
nice.
think that's it. yeah.
And the balance and the, kind of that equilibrium reactions.
Yep.
Okay, good. You have a home exercise program or?
Yeah, so we said you can do the wheelchair dips at home, and all the ones that we did with the TheraBand, minus the serratus one, could be something that he does at home as well.
Okay. Okay, can you read your note, please?
Patient complains of difficulty with transferring between wheelchair and mat and back, with occasional loss of balance. Patient has sometimes a dizziness and increased heart rate. Objective, patient performed dips and wheelchair independently, alternating isometric with min to mod contact guarding. Patient received home exercise program including triceps, biceps, and deltoids. With TheraBand, 3 sets of 10 or as tolerated, educating patient on symptoms and intervention of autonomic dyslexia. Assessment, patient had mild loss of balance with alternating isometrics, independently performed wheelchair dips. Plan is continue with the current plan of care to increase upper extremity strength and improve transferability as tolerated.
Good, nice, very nice. You guys are really doing well on your documentation. Are anybody documenting in the clinic?
Yeah.
Yes.
Yeah,
Good.
I do it on
A
all my
lot.
patients.
On what?
I do it on all my patients.
Yeah,
Excellent.
same.
Excellent, how are you doing with it?
Their system's pretty easy. I forgot the name of the program, but it's computerized, so if it's a patient you've seen previously, you can forward the flow sheet, and then you have exercises, so then you can modify. So like, let's say last week I did 3 sets of 10, whatever, and this week I did 4 sets of 10. I can just change what I need to.
Nice.
And then, of course, when you get to the soap part, it has assessments, so you can put improved today and such. So it's really easy to do it.
And it's organized, it sounds
Yeah.
like, which is great. Okay, nice, very nice.
Sundar's with me,
Are you
and
filming?
he has a lot
Oh,
there.
Sundar's,
Yeah,
okay.
he's doing a lot.
I
It's
wasn't
looking like
until you
full-time
said
more, but
something.
What?
He's doing
Said
a
I
lot.
wasn't until you said
Okay,
something.
well, that's the way it should be then.
Yeah.
For the rest of you that aren't documenting, ask, you know, can I write, you know, a note on this patient and show it to you, and can you give me feedback? Okay, this is the chance to practice. All right, this is the chance to say, do you mind if, or I've never seen that, can I watch an evaluation? Or I was thinking about these two exercises, what do you think? Right? This is your time to be an active learner, active participant in everything. Okay.
Okay, patient is 18 years old, status post-vertebral fracture, resulting in T9 Asia A spinal cord injury.
Which is what?
Complete.
Okay.
Good strength of uninvolved extremities.
Okay.
So first, we're gonna show activity to improve wheelchair mobility.
And say all of
Mhm.
Do we say all of Yeah. Okay, so we're gonna perform one activity to improve wheelchair mobility. We're gonna perform one balance activity, and we're gonna instruct one patient exercise so they can perform it on their own.
Okay.
There you go. We were gonna kind of keep it simple instead of using the parallel bars, because we could do a bunch of exercises for the mat, so.
Okay.
We talked about that, but there was a couple other ones, so, I mean, just for time's sake, but I know we could do just like what they did earlier about the same weight shift.
Mm-hmm.
But we were just gonna do it on here and
Okay.
make use of the push-up bar. So, the good thing is that, because this is low enough and the upper body strength is pretty good, and also her age being young, I figured like she can try to do more, and she probably should try to do more.
Yeah,
Because,
for sure.
especially at that age, I think she should try to feel that she's independent.
Absolutely.
So, you know, a lot of this, we're gonna be talking her through it. Okay, Joanne, Michael, we're your PTA for today. We're gonna have you sit on the mat, so if you could wheel yourself closer. Is your right or left hand dominant?
All right.
Guess what, you gotta go the other way. You could do it. Yeah, because we'll do that stuff on the mat.
Both hands are strong.
That's right. Okay, so I'm gonna back up just a little bit here. All right, wheelchair is locked. You can remove the legs, and I'm just gonna bring your leg across. Good. Thank you. All right, wheelchair is locked, and Joanna's been with us for a couple weeks, so she knows how to do a training. I'm gonna just tell her a few cues. All right, so yeah, if you want to do that, but make sure you lift this leg up. Remember, you slide. Okay, so you want to push and kind of inch a little bit at a time. You don't have to do it all in one big push. All right, use the wheelchair, push over. And I would just kind of be close here to make sure the feet don't slide out. And she's not going back onto the mat, so I'm going to leave her shoes on. Is that okay? So again, we really want to try to develop some more independence, so encourage her upper body strength. So everyone was doing this in the wheelchair, and I know she can too, but we thought we could also use this
Good.
and then progress it into other things.
Great.
So you can use the, just like you do on the armrest on the wheelchair, push yourself up. You can do a hold, she can concentrate on eccentric, she can do high repetitions. I mean, depending on where she's at. You know, if she's feeling fatigued, we can do high repetitions to get build up endurance and such. Another one I thought she could get
Don't
used to
forget
doing.
about the breathing, right? When
Oh,
do you
yeah,
breathe?
exhale.
When do you breathe in? Concentric or eccentric?
Eccentric.
Doesn't matter
Exhale.
Really doesn't
I do
matter.
know.
As long as you do in
Just
on
tell
one
people
and out on
exertion.
another. There's so many
Yeah,
different
exhale.
ideas and theories about when you should breathe in and when you should breathe out. Just make sure they breathe, okay?
And then as far as going through, what was the other one? Mobility, right?
No, balance.
Balance, yeah, so, right, we were gonna do the reaches. So instead of using this here, of course, she's supporting herself with her arms, but because she's strong enough, I shouldn't have to do contact guard, and she should be able to reach for objects coming across.
Yeah,
Shift
I
your
would
weight.
just put your your body in a way that you can catch her if you need her.
Sit.
Okay.
Need to, right? Just,
And
yeah,
Keep it going.
just always be ready for whatever can
So
happen.
reach out. And I would try to progress it to where she has to lean and use both the weight shift of her hands, because obviously she doesn't have the abdominals really, but, and then from here, one that we're gonna tell her to practice at home is if she's sitting on the edge of her bed, because we're trying to develop the strength from that shift from the wheelchair to either the toilet, to bed, whatever, is that she can actually move side to side, right? So remember, you can push up, scoop her, over, and again, slide and then slide back. And with this here, you know, I think she should get used to lifting the legs on her own, because she's gonna have to be independent.
Yep.
And so she would shift over,
Good.
one, legs, shift. I guess that also kind of works with balance, you know, she's gonna learn how
It
to
does.
coordinate with one hand
For sure.
here and,
For sure.
and then for,
You guys,
Getting out of bed.
Mr. Mitchell's birthday.
The home exercise.
Mr. Mitchell's
Oh, yeah.
birthday. It's Mr. Mitchell's birthday today.
Oh,
The big one too. Sorry.
50? That's a big one. So, home exercise,
It was a big one.
I would have her lay in prone, and we
Okay.
could do modified push-ups that she could do at home.
Great, go ahead.
To practice, yeah, so you can scoot back and roll over, just leave your feet off the bed.
and practice
Okay.
rolling.
So remember how yeah, she can do, obviously this is gonna be down because she doesn't have innervation there, but she can practice pushing up, and then she can also practice shifting.
Probably not so high. May not be
Rolling
able
over
to
to
so
the
high.
one side, and
Mhm.
pushing with one arm,
Yeah,
and let's see you
Nice.
roll over to your right side. Yeah, but you remember how we did it with, so you can go down, yeah, that's
Roll
good,
switch your head.
yeah, and then of course come back.
to get out of bed.
Yeah, just to get all those
And
muscles.
another one I thought she could try to do too, depending on where she's at, but if she reaches her arms out, she can practice at home where she lifts an arm up on one side and
Yeah.
then switch to the other side.
Nice.
And even though this is kind of working shoulders and arms, but I'm thinking that too, that maybe some of her back muscles might also help in that.
Mhm.
Support.
And maybe she can even progress into trying to do both arms. I mean,
Good. Nice.
But that's,
What's
because
fine?
this is probably gonna
Yeah,
help her the most as far as make up
Right.
for this absence.
Exactly.
But these, I think she can do at home, it's pretty safe, because she's gonna be in bed,
She's
she can
gonna
be
be
in the
in bed,
middle
yeah.
of the bed.
Yep.
Worst comes to worst, I mean, she's just gonna go to one side or the other.
Good, nice, very nice.
But I think that covers all of them, right? Did I miss anything, Melissa?
No, that's it.
Okay.
Nope.
So your home exercises, those stretches and
Yeah.
exercises in bed. Okay, good. Okay, you wanna read your
Can you
note?
read them? I read them.
Okay, so subjective patient complains of difficulty transferring from wheelchair to toilet.
Okay.
And objective 18-year-old status post complete T9 lesion, Asia A, with good strength to bilateral upper extremities. Patient performs sliding board transfer wheelchair to mat with verbal cues. Patient performed tricep extensions using push-up bar on the mat. And instructed patient on home exercise program, prone modified push-up, and patient perform weight shifting and sitting for balance. For assessment, patient transferred independent from wheelchair to mat with a sliding board, and patient required only verbal cues to maintain balance when sitting.
Okay.
And for plan, it would be to continue wheelchair transfers in different environments.
Great, great. And you know, just again, you can comment on less assistance required or more reps able to be done. I don't know if, you guys have Professor Ross, right? Yeah, okay. So, did she talk to you about front transfers?
Oh,
Yeah.
this is-
Yeah. So I've used, for patients that, you know, just reminding me when you said that they had difficulty transferring onto the toilet. I've done a front transfer, for the toilet. Now, you know how the toilet seats are mostly, you know, sort of, you know, semicircles, but, it may be easier for them to come on to the toilet and just transfer like this and sit on the toilet like that. Okay? If they can't manipulate their wheelchair, if they're having a lot of trouble, they can't get, you know, they can't use the sliding board or whatever, I've done just a front transfer onto the toilet, and then they just have to reach back and then go backwards. And that usually makes life a little bit easier for them, especially in New York apartments where, you know, your bathrooms are pretty small. Okay? Again, the seat's not that comfortable, but it's another kind of, you know, option you have. Okay, good. Number 4.
So, so we have patient is a 58-year-old status post fall from a ladder, resulting in an incomplete lesion of the cauda equina, patient with bilateral weakness of the lower extremities and fair plus strength, bilateral upper extremities with fair plus strength from prolonged hospitalization. So we are performing strengthening for both upper extremities, strengthening for both lower extremities, and endurance activities.
Good. And we were talking before about how do you tell the difference between tone and strength, right? It's only your differential diagnosis. Tone is something nervous system, right? Is it, you know, it's central nervous system, is it brain, is it spinal cord? Strength is disuse. So if she's a patient with a spinal cord injury, her lower extremities, it's a tone issue, right? Her upper extremities, it's not a tone issue, it's a disuse issue, so it's weak. Are you starting to see that a little bit more clearly? Difference between tone and strength? Like someone with flaccidity, it's not because they're weak, okay? It's tone that affects their flaccidity. But if a patient has been in a motor vehicle accident and has some lower extremity spasticity, but weakness in the upper extremity because they haven't really been out of bed for a few weeks, that's a strength issue. So you would strengthen with manual resistance or weights, where the lower extremity would manage the tone with neurophysiological techniques. Okay, is it starting to kind of gel together a little bit?
Yeah.
Okay.
Well, now our lower extremity thing might not make sense. We were given a strength grade though.
Yeah, because
So-
it's an incomplete lesion.
Yeah.
That's why.
Okay. Yeah, so I mean, the first thing, hi Sue Ann, I'm Liz, I'm your PTA. The first thing we were thinking was just simple manual resistance.
Great. I love
so
manual
Plant your feet on the floor. Okay, and push up
I'm
against my
sorry.
hand. Push up,
Especially
up,
with a patient with a neurological problem, I love manual resistance because you can tell when they're fatiguing. You can increase your resistance, you can decrease your resistance. You can say, okay, that's probably enough, right?
Yeah.
So whenever you get your hands on someone, it's so much more effective.
Yeah. Okay, so push up against my hand. Up, 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 up. Good. Okay. This side, up, up, up. Good.
So
Okay,
now she's
times.
having difficulty, right? And you really wanna get that full range.
Yeah.
So you may back off a little bit
Yeah.
with your resistance, so she can come up a little further.
Yeah.
Cause right now you're kinda doing an isometric,
Yeah.
right?
Right. Okay,
So you want her to come up.
come up into my hand. Up, up, up.
Go,
Good.
go, go,
Go, go, go, go, go. Great. Relax. Other side. Go,
Good.
go, 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 go,
You see
go,
how
go.
that works?
Great. Yeah. I'm
Cause
like,
she
I'm not
wasn't,
resisting
she
at all.
really was just kind
Yeah.
of contracting the muscle and that was
Come
it.
on. Okay, and same for, lower, you could say, kick out against my hand. Kick me,
Okay,
kick me, kick me,
stabilize
kick
above the
me.
knee. Stabilize.
Oh, great.
There you go.
Okay.
Good.
Good. Relax.
This way you know you're gonna get the motion you
Go,
want.
go, 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 go. Good. Relax. And, so up or two, we could do manual, or we could do weight, or we could do, okay, I'm gonna grab your hand. Okay, pull me. Pull, 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 pull. Good. Yeah.
Good.
Same on the other side.
And just try to
Do abduction.
probably stabilize above the shoulder too. Try it again.
Okay.
There you go.
Okay. Pull, 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 pull.
And this way you know you're not doing damage to the shoulder and you're getting the right muscle
Pull, pull,
that you
pull,
want.
pull, pull,
Otherwise they can
pull.
substitute, right?
Yeah, and
I
try
can
and
do this, you know?
Yeah. Good point. Yeah. You want to say something?
For what? Which one?
We were also gonna do band walks, for both endurance and lower extremity strength. Do we have it there, Ben? You should have. Oh, okay, that'll work. So, and she can stand and walk, so that's great. So come on up. And we would just tie this
What's her standing balance, does it say?
It didn't say.
Okay. I might do this on parallel bars, just to be.
Okay, should we,
safe. No, I'm just, I'm just putting my 2 cents in.
okay, so, okay. So go ahead and just take steps out to the side. Good, together, good, together. You know, we can
Yeah.
measure how far she goes. Okay, come back,
Nice.
out together, out together, good.
Nice.
Okay, have a seat.
Now, if in doubt, you can just stand in front, have her, put her hands on you,
Yeah. Like
support
hold
her
her.
like that, yeah.
Okay.
Therapist Joe?
Okay. I also was just gonna could they do sit to stand technically too?
Should be.
Okay.
They got fair plus strength of the lowers, they should.
Right, so, yeah, I can use my hands as well too, so what I want you to do is just to come up. If you need any balance, go there.
Okay, so to progress it to stand, okay, what would you start with? If you wanted to do it, make sit to stand progressively harder, how would you do it? Start first with,
Oh, yeah, you can do take one arm for support.
okay, but first you would start with
Well, both arms,
both
yeah,
arms down,
Both arms
good.
down. Then you can do one, then you can do without the arms, and then, really advanced, you can do just one foot off too. Or
Right.
then, less pace.
Yeah.
That as well too.
So you can
Okay.
just keep making it harder and harder for them.
Right, okay.
Okay, I'm sorry, go ahead.
And then,
No, complete it. I
Okay.
interrupted you, sorry.
so, place hands across here, and then you're gonna come up to stand, count 3, 1, 2, 3, sit down.
Okay, what's gonna make it easier for her to come up to stand without her hands?
Just
I'll scooch forward.
Toes over the nose. Nose over the toes.
Oh, nose over the toes. Oh, so nose over toes and then stand up. 1, 2, 3.
Much easier, right, to bend
Yeah.
forward than to just.
Rather than they're so
stand.
far back,
Yeah.
yeah. Okay. Yeah, then we had the exercise for this, but Liz did that already too. And then for endurance, we said walking just for 15 minutes for endurance. What do we say for that?
lay on your back. So this is something you can do at home in the morning when you wake up. Just raise this leg and this arm. And hold and slowly lower down. Good. This leg, this arm. Hold, slowly lower down.
What kind of exercise is this?
For endurance and lower extremity.
Okay, for strengthening and endurance.
Yeah,
What would make it endurance?
multiple
Yeah,
reps.
it's like 30 reps without resting,
Yeah.
right? Or instead of walking, because she's walking without you probably,
Mhm.
or, you could do marching in place,
Hmm.
right?
Standing?
Standing.
Yeah.
In the parallel bars,
Yeah.
but high stepping.
Yeah.
It's interesting, this weekend I read that if you really want to do a good, hip flexion, you mark your iliac crest and you mark your popliteal, or you mark where your patellar tendon is, and then you half the distance. So it's from the knee to the hip basically, and you do half, and they have to get up to at least that point to really do a good, strengthening and endurance.
Yeah.
And if you're marching that high, believe me, 30 seconds is a long
Yeah, they're gonna
time.
feel it.
They're gonna feel it after 30
Put
seconds.
hurdles in the parallel bars.
Yep, good.
And they can start off holding on,
Mm-hmm.
and then maybe one hand, no hands.
Yeah. We can bring her the peddler and have her do, the upper extremity peddler. We could have her do the lower extremity peddler. There's a gazillion endurance things, right?
Then, wait, can you go in the sideline position on your right side? And then, just put a sweep and place it there, and then they can just do hip abduction with that. Hip abduction. Yeah. Well, what's bad with that?
It's better to get an ankle weight.
Yeah, it's better to
Oh,
do a
yeah.
cuff weight. Better to do a cuff weight.
Oh.
That's
Okay,
not
yeah.
really doing anything.
Right, yeah.
You're gonna do external rotation, or anything like that.
Yeah.
Oh, stop.
Jesus.
I see what you're saying, but it's.
Yeah, no, I just so.
Yeah, cuff weight, you know,
Cuff weight,
anything,
yeah.
yeah, you gotta, if you're
Yeah,
gonna,
the one broke.
you gotta weight the lower extremity if you wanna do the strengthening.
Yeah, so, alright. Any other exercises?
No, that was it.
That was it, okay.
Right.
Yeah, I think so.
Okay,
So 58-year-old patient status post fall from a ladder, incomplete lesion on equina, patient complains of weakness in bilateral upper extremity and lower extremity. Objective is fair plus in bilateral upper and lower, side lying, body weight or, ankle weight, hip abduction for 20 times 2 for endurance. You want the strength, improve the abduction during the gait cycle. Sit to stand with chair or bed for 20 by 2, and like we did, less support to progress the exercise. And then shoulder abduction 20 times 2. It's bilateral upper and lower. And then patient is independent with therapeutic exercise. Sometimes uses verbal cueing for proper form. And transfer is executed independently, and cessation is bilateral upper and lower extremity is intact. And educate the patient with HEP and continued plan of care.
okay. Good. And I would just separate those sentences, right?
Right.
Transfers independent, period, and then sensation, cause they don't really get it. Okay, good. All right, so, I need a patient to sit in the wheelchair. Everybody's done, right? That's it?
Yeah.
Okay, let me get my timer. If somebody sit in a wheelchair as a patient,
Or Alan's, already in a wheelchair.
That was way back there.
okay, give me a pathology, somebody.
You want me to, okay.
Yeah.
Okay, give us a pathology.
Right, CBA.
Right, CVA. Okay, give me some other details, somebody else.
Brunstrom stage 4.
Brunston stage 4 of upper or lower, both?
Both.
Okay. Okay, Brunston stage 4, upper and lower. Okay, somebody else give me one activity to perform? Maybe Sue, can you write it on the board? The 3 activities. Okay, what activities you wanna see?
Facilitate progression through stages of
Okay,
Whatever.
promote normal movement
Yeah.
of
upper extremity.
upper extremity. Promote normal movement of upper extremity. Okay, what else? Oh, and the balance is what? Fair. Okay, static or dynamic? Static. Okay. Okay, so we got promote normal movement of upper extremity. What's another activity? That's a
It's
given.
Sorry, it's just right CBA with, what was the other thing? Specificity?
Stage 4 upper and lower.
Upper and lower, okay. So facilitate normal movement in both.
Okay, normal movement, okay, so the first activity is promote normal movement of upper extremity. The
What about
second is lower extremity, and give me a third activity.
strength and uninvolved? Or,
Improve strength and uninvolved,
yeah.
okay. And strength and uninvolved. Okay, so I need 4 people to treat, I need person to transfer and 3 people to do activities. Who wants to do it?
You want to do it? You want to trade?
Yeah.
Who wants to
I wanna
treat?
practice.
Who wants to treat?
I wanna treat.
I'll do a treat.
Okay? You want to transfer or an activity?
I don't care.
Melissa.
What's the last thing that someone wants to do?
Liz, what activity you want?
I'll do the transfer.
Transfer?
Yeah.
Okay, Michael, you'll do normal movement of the upper.
Upper body, okay.
Okay, who wants to do normal movement of the lower?
Do it.
Okay, and who wants to do improved strength of uninvolved?
Kevin.
Kevin, yeah, I was gonna say that.
Kevin didn't do anything so far, come on. I didn't see anything that all day.
He's tired. He's really tired.
To run here.
Yeah.
Hello.
Okay, so I'm gonna time it, you, the three of you guys get together and tell me,
right, you transfer.
when the transfer's gonna occur. So we know the transfer first, the transfer last, the transfer.
I'm fine with doing a transfer first to the mat, because I think it'd be easier to do the normal upper body, lower body, and the mat, and the strengthening.
Okay, anybody
Because it's-
doing anything in the bars?
Kevin?
Which one?
We don't have to, but I'm saying.
Normal, upper
Anybody-
upper body
anybody
to
doing
lower body.
anything
I'm
in
just
the
saying,
bars?
because to get that to move through the
Yeah.
associated
You know,
reactions, I
stuck
think
in
it's
that
easier
chair.
here.
Yeah, for sure.
Okay, everything on the mat?
That would be my opinion.
Okay.
I'm not
Who's,
Okay.
sorry, who else is treating?
Kevin.
Kevin. Right? What is your strength exercise?
Oh, balance,
Okay.
balance.
Like
We
a
have to do
commercial
balance.
cabin.
No, we didn't have to do balance. It was just promote upper, lower.
Promote upper,
And
lower,
strength.
that's two different people,
Correct.
and strengthen the
I
total.
That's what I'm saying. I think
So
that would
who's
be.
the, who's doing, you're doing upper, who's doing lower?
If they're balanced on better,
Oh,
fair
okay.
plus, yeah, pushing back.
Who did we forget?
What do you wanna do?
Yeah, you're okay with Matt, right?
I just don't know when to do the transfer.
Oh, I was
Do
gonna
it
the
now.
lower extremity. I can do it, yeah, I can do it when he's on the mat.
Okay,
Yeah.
So we'll start
so
with the
transfer first and then 1, 2, 3. Tell me what you're doing and your rationale, okay? Ready? I'm gonna time you. Tell me when you're ready.
I'm ready.
Okay, let's go.
Hi Joey, I'm Liz, I'm gonna be your PTA. For starters, we're gonna get you on the mat, so I'm gonna go ahead and. Okay, so I'm gonna just move you around.
And everybody else grade,
Lower extremity.
write notes.
Okay.
Promote functional movement of lower extremity.
Okay. Okay. So, let's see, wait, so, okay. Could you lift up your leg? Thanks. Put it down. Sorry. I'm gonna lift up your left leg. Great. Okay, so what I'd like you to do, loosen up your seatbelt just a bit. Don't undo it. Okay, so push down with this arm and this leg and just scoot with you a bit.
And tell me what you're doing.
I'm gonna transfer my patient from the chair to the mat using a stand pivot. With moderate assistance?
Go ahead. Go ahead.
Okay.
We'll talk later.
Okay. Okay, so I'm blocking the left side. Okay, so I'm gonna go ahead and remove your seatbelt. Okay, sorry. Okay, could you scoot your right side a bit closer to me? Okay, I'm just gonna go ahead and move your left side a bit closer. Okay, so what I'd like you to do is push down with your hand and plant your foot, and on the count of 3, we're gonna stand and turn and pivot, okay? All right, so 1, 2, 3, stand up and turn, reach for the bed. Okay.
Okay, number 1, hop in there. Thank you.
Okay.
Tag team.
Don't fall.
Hold him. Hold him. Hold him.
All right, here we're doing, Liz had to go to the bathroom, so I'm gonna take it. All right, so his left side is involved. And stage 4 means that he's starting to come out of spasticity.
Okay.
So we'll just pretend it's kind of here. So Joey, we want to get this arm to extend a little bit more. So I'm gonna just sit here just because I don't want you to slide, because I'm gonna take the use this arm. And if you would hold here and hold here. Now with this right arm here, we want to try to get this arm to move a little bit more and to extend, right, to reach out. So with your right arm here, I want you to push against me, and I'm going to try to push out. So hopefully, pull out. So hopefully the left arm will start to do it, okay? So push with the right arm, push, 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 and now pull back in, good. And then push out with the right arm, push, 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 push. Pull back, good. Push, 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 and pull back. So coming back here, I'm trying to resist a little bit more and not letting the spasticity pull him all the way back.
Okay.
But, and hopefully, a little bit.
Okay.
Okay.
Okay, next.
Next.
Yeah, I want to double check something, because I thought you said you wanted to promote strength in the uninvolved lower extremity. You have 2 upper extremities up there. You said lower extremity.
Yeah, what's up?
Uninvolved extremities, I think. Oh,
It was
no,
upper
sure.
and lower. It
But
was
you're normalizing tone in the involved side.
In the involved side, yeah, in
Correct.
the lower extremity.
Lower, yes.
Yes.
Okay. Normalizing tone.
And then Kevin is just doing the upper and lower in the uninvolved.
So you are on right here, so your left is an extensor spasticity. Right, so you're gonna stop like this. And that one is set. Yeah, wouldn't it be? If it was sitting, it would still be an extensor spasticity.
Yeah, no, it's
He's
usually
four,
when he's
so-
up. He's good, he's coming out,
Coming back,
he's
okay.
coming out.
So I wanna promote strength, actually, I could use like.
Not
a
strength,
towel.
normal movement.
Yeah, okay.
Don't fall. He hasn't started his treatment.
I haven't started.
And
I'll
this
leave
was
you
where
patient
you would
alone.
say, can you please watch my patient?
Or no, I have what is it? Impulsive
You're a
Never-
right CDA, you're gonna leave.
Never trust a patient with a right
Normal
CDA.
movement of the left. Can you, I can take this shoe off for you. Sometimes it's always my,
downfall.
yeah, getting the patient's shoe off. Pull it. Ow! You're squeezing my tendon. Put this towel underneath your, like this, and then basically, all I want you to do is just try to bring that leg back as close as you can, like to the table. Just bring it in as much as you can.
Okay, so you're performing,
I'm performing an exercise to promote functional movement of the left lower extremity.
Okay.
And if it's too difficult, you can actually put the other leg in front and just kind of assist it a little bit. But, you know, as you progress, you should be able to do it without it.
okay, and then I might say, why are you working on flexion?
Because he's an extensor spasticity.
Thank you.
Right.
Okay, next one, jump up.
For his uninvolved side, I could just do a lot of manual stuff. So, let's see, I
Explain
want-
to him why you're doing it.
Alright, Joey, so I'm gonna work on your right side, instead of involved. I'm just gonna apply force and you're gonna go against me in the opposite direction. Okay, so I'm gonna push, so if I wanna work on the extension, I could put him into flexion, and then he's gonna go into an extension. So I'm gonna push towards you, you're gonna push out, okay? Push that, move the opposite way.
Don't forget to stabilize above the joint, right?
Yeah.
Okay.
And I can go hip flexion. Same thing with his upper body. I can go bicep, tricep, shoulder.
And why are you strengthening the right side? Why are you focusing on that side?
He's dependent on it.
Exactly.
Could there still be some weakness too on this?
Yeah,
one?
sure. Sure, maybe it's disuse, he's not as active as he used to be. Okay, 6.5 minutes, nice job. Okay, let's,